Welcome back from the break, and welcome to Topics panel discussion on quality improvement in action, building capacity, consistency, and system-level insight. My name is Nakrishi Lamptey, Deputy Chief, Medical and Scientific Support, Population Health at Public Health Ontario, and it is my pleasure to facilitate this session and discussion. Before we begin, a quick reminder about how the session will proceed. We will begin with insights from each of our speakers, followed by a question and answer period. To optimize everyone's experience, the Zoom chat and audio video features have been disabled for this session. Please feel free to submit any content-related questions in the Q&A function at the bottom of your window. For technical issues, please email tophpp.ca. Today, we are fortunate to have a group of esteemed professionals with us who bring a wealth of expertise and insight into the topic of quality improvement implementation. In this session, we will explore the landscape of quality improvement initiatives in Ontario, understand the scope of the challenges, and identify effective strategies for public health action. Let's get to know our speakers. Today, I'm joined by Rob Hale. He is a public health planner at Southwestern Public Health, where he supports cross-organizational teams in program planning, research, evaluation, quality improvement, and program-level performance measurement. He brings experience in applied public health ethics and qualitative research with a focus on population-level planning and strategic thinking that helps programs track progress towards broader public health objectives. Rob also serves on Public Health Ontario's Ethics Review Board, contributing to the ethical oversight of evidence-generating initiatives across the province. He is committed to advancing practical, community-responsive improvements in public health practice. Next, we have Dr. Kelly Pilato. She is an assistant professor in health sciences at Brock University. Her research focuses on quality improvement, implementation science, and how health systems shape health and population well-being. Using a system-level approach to understand implementation processes and their real-world impacts, she is interested in how these processes support health and wellness across the lifespan, within the context of people's lives and related social determinants of health. Her work is community-engaged and interdisciplinary, including collaborations with public health agencies, universities, and provincial health organizations. She is committed to meaningful knowledge mobilization and building bridges between research, education, and practice. Up next, we have Jessica Brett, a registered nurse with specialty certification in community health nursing. Since joining Ottawa Public Health in 2015, she has held progressive leadership roles across public health programs. In her current role as a nursing project officer, Jessica leads strategic planning, risk management, and evaluation, and has overseen the implementation and monitoring of Ottawa Public Health's strategic plan since 2023. With a background in lean principles and nursing practice, she brings expertise in evidence-based program planning, quality improvement, and performance measurement. Jessica is recognized for her collaborative approach, strong facilitation and communication skills, and ability to manage complex initiatives with insight and innovation. And finally, we have Nastasia McNair, the manager of the Effective Public Health Practice Team at Public Health Sudbury and District. She leads research, evaluation, and knowledge exchange initiatives that strengthen evidence-informed decision-making across the organization. Since joining the agency in 2014, she has worked across multiple program areas and played key leadership roles, including in the implementation of program planning processes and tools, accountability reporting, and stakeholder engagement. Nastasia holds an Honors Bachelor's of Science in Biology and a Master of Public Health, and is committed to helping public health teams apply evidence in ways that improve health and create meaningful change. So with that, welcome of our esteemed panelists. We'll now transition to our presentation.
Hi, everyone.
So,
Sorry.
just before we bring in Dr. Pilato, I'll just start with a little bit of a general background, including the outline of the lesson. So we have the introductions that we just went through. We're going to summarize a little bit of the Public Health Ontario framework for quality improvement and give you a sense of where some of that work is headed. Then we'll welcome Dr. Pilato from Brock University to talk about the results of the Provincial Quality Improvement Maturity Tools Survey. And then we'll have our spotlight, our main event on local public health units, including Ottawa Public Health, Southwestern Public Health, and Public Health Sudbury and districts. So if we go to the next slide, please. Thank you for bringing your energy and interest to our conversation today. And we anticipate that at the end, you'll be able to describe the culture, background, and context of quality improvement in public health in Ontario, be able to compare different tools and QI strategies demonstrated by the presenters, and interpret their use for your own public health practice. And hopefully you'll be able to explain how program planning, measurement, and quality improvement can be applied in public health settings such as your own. If we go to the next slide, this is likely a refresher for many of you. At Public Health Ontario, the Quality Improvement Team has adapted a definition of quality improvement from Health Quality Ontario and the Institute for Healthcare Improvement to apply to the public health context in Ontario. And this is a reminder that quality improvement is a proven and effective way to improve community services, care for clients, and to improve practice for staff. In the health system, there are always opportunities to optimize, streamline, develop, and test processes. And quality improvement should be a systematic, data-driven, continuous process, an integral part of everyone's work, regardless of your role or position in your organization. And you can see here on the right that there are central concepts to improving quality, addressing the dimensions of client experience, population health, reducing cost, improving team well-being, and advancing health equity. If we go to the next slide, Public Health Ontario has also adopted the quality improvement implementation approach from the National Health System in the United Kingdom. This framework names key elements in the implementation journey, and this colorful framework, I think, is a useful reference as you look to your own quality improvement initiatives. If we go to the next slide, as you think about applying quality improvement locally, there are some key questions that can help drive that work, such as what are we trying to accomplish? Identifying the opportunities to plan for improvement. How will we know if there has been a change in an improvement? And that often involves figuring out how do we measure an impact. And finally, what change can we make that will result in an improvement? And making sure that as we implement, we celebrate any small successes that are developed. If we move to our next slide, what you can look forward to from multiple streams of work at Public Health Ontario is we are working closest with the Office of the Chief Medical Officer of Health to align quality improvement priorities in our sector. We are working closely with you at the local level to develop a multi-year plan for advancing quality improvement work. And we will hear about that we will repeat the Quality Improvement Maturity Tools Survey in 2027. And please join us in a Public Health Ontario rounds on the Quality Improvement Maturity Tool in April, a few short weeks away, April 23rd. So with that, I'm going to give a warm welcome to Dr. Pilato, who's going to be our first presenter on our Quality Improvement Maturity Survey results. Welcome.
Thanks, Dr. Lampy. And I apologize, I jumped the gun. I was so excited. I was going to say, hi, everyone, I'm Kelly, and I'm super excited to be here today to discuss the QI Maturity Survey results. So we can just go to the next slide. Thanks. So we know quality improvement is important, and it has been recognized in various ways in public health since 2026. We know that other health sectors have had mandatory requirements to do QI, But public health really is in this unique position to be able to continue on in this agenda that sort of honors the nuances of public health. QI has been the focus of practice, research, and discourse in Ontario public health units for over a decade, and it really is an important part of performance management and was recognized in 2006 by the Capacity Review Committee. And QI was included as a required activity based on the Ministry of Health and Long-Term Care report in 2011. However, the application of QI in public health units really has varied across the province. Individual public health units um, really have been developing innovative ways to do this work based on their own specific organizational structure, staffing, and understanding of how to apply quality improvement. But this means that quality improvement in public health units really does look different across the province, which makes it difficult to share information, learn from one another, and develop common standards of practice. So unlike other health sectors like hospitals, for instance, public health units don't really have required performance indicators and action plans that are reportable to Ontario Health for quality improvement plans. So this makes it an interesting opportunity for public health units to engage in QI work and do so in a way that makes sense in the public health space. If we can just go to the next slide. So overall, the QI maturity results show that in our 2025, the most recent edition of the survey, nearly half of the participating public health units were categorized in that beginning stage, while 16% were in the emerging stage, 20% in the progressing stage, and 16% in the achieving stage. No public health units were categorized as excelling at the provincial level. Compared with 2016, there was an increase in the proportion of public health units categorized in the beginning stage and a decrease in the proportion in the emerging stage, alongside an increase in the achieving stage. When we look at what is happening across QI dimensions, so if we look at QI perceived value, so where the staff beliefs about leadership support and QI's impact, in 2025, 48% of public health units were categorized as excelling, 24% in the progressing stage, and 24% in the emerging stage. Only 4% of public health units remained at the beginning stage. In contrast to 2016, the majority of public health units were categorized in the achieving stage, with a smaller proportion in the progressing stage and none at any higher maturity stages. When we look at QI capacity and competency, so things related to skills, methods, and structures for QI, we can see that in 2025, 76% of public health units were categorized in the beginning stage, while 16% were in the progressing stage and 8% in the achieving stage. No public health units were categorized as emerging or excelling. So although the proportion of public health units at the beginning stage increased slightly from 67.6% in 2016 to 76% in 2025, there was a reduction in the emerging stage representation. So it was 20.6% in 2016 and 0% in 2025. When we look at organizational culture, so the norms, values, and staff relationships, in 2025, QI organizational culture identified 40% of public health units as progressing, 28% achieving, and 12% beginning, 12% emerging, and 8% in that excelling category. Compared with 2016, there was a decrease in public health units at the progressing stage, so it was 52.9% in 2016, but an increase in higher maturity stages, including the emergence of some public health units even being in the excelling stage in 2025. I think we can go to the next slide. So the results of the survey provide important insights, particularly that QI competency and capacity emerged as the lowest scoring dimension. This highlights that there is a clear need to prioritize foundational QI education and training to strengthen system-wide capacity and competency collectively. The variation across this dimension really does reinforce the current state and identifies opportunities to reduce variability across the province. The results are valuable to inform QI initiatives and to serve as a benchmark for future measurement and comparison. Higher QI perceived value scores highlight opportunities to focus future QI work. This work can be leveraged to direct QI efforts and programming to ensure it meets the needs of public health units. The results provide a strong rationale for continued QI education because of the lower scores consistently found in the QI capacity and competency dimension in relation to the use of systematic improvement methods, staff training in QI methodologies, awareness of external QI's expertise, and integration of QI into daily work. This really emphasizes the opportunities to strengthen capacity and embed QI more consistently into operational practice through things like QI skills, training, and infrastructure to really support sustained quality improvement. And lastly, leadership influence did emerge as an important theme that needs to be further explored to better understand targeted strategies to sustain momentum during periods of transition. I'm just seeing the message here. I'll pass it over to Jessica. Thanks, everyone.
Thank you, Kelly. And you can go to my next slide. So good morning, everyone. I'm pleased to be joining from Ottawa Public Health to share how we are advancing QI readiness and culture. And we'll just say that a lot of what I'm talking about today is the excellent work of our Quality and Change Management Officer, Tara Mann. So starting just with some context setting, for anyone not from an Ontario Health or not aware, the Ontario Public Health Standards set out the minimum requirements for health units in Ontario. And I know we're all patiently awaiting the release of the new standards. But if we look at the draft that was released towards the end of last year, what we saw was an emphasis on the full suite of QI practices and tools versus formal program evaluations. And that's not to say that program evaluation doesn't still play a role, because of course it does. But seeing this shift in greater emphasis on QI really brings the question of what does it take to build a sustainable QI culture? Next slide. And having a QI culture is really about more than just a collection of QI projects. It's really about integrating QI practice into our everyday practice. And to be able to do that, it's important to have the systems in place that enable that practice so that we can ultimately drive results. And at Ottawa Public Health, our strategic plan, our quality improvement plan, as well as operational plans intentionally act as the systems to build that readiness. Next slide. So looking specifically at our quality improvement plan, it includes 3 components, which is compliance and risk management, client safety and experience, as well as advancing quality culture. And these 3 areas came about from a variety of planning inputs. And what our QIP does really importantly is that it signals clearly what are our priorities as an organization when it comes to quality improvement. And then also there's several initiatives within our quality improvement plan within these buckets that are really building the foundational systems and processes that enable QI at every level of our organization. So just one quick example is that we recently updated our complaints procedure and our complaints management system for how we receive and respond to complaints. So that's just one example of a project under client safety and experience. Next slide. And so as I talk about systems, and I love to think in systems, but I recognize that sometimes it can actually be challenging to find the time to build those systems. And especially at this time right now in public health, a lot of us are experiencing very high demands. We're seeing very complex needs within the community, and together that's really challenging our capacity. But what I'll say is that there are still opportunities to accelerate QI readiness, and I've listed lots of examples on my slide. Sadly, don't have the time to go through all of them, but happy to connect afterwards if anyone sees something of interest. But I will just speak to one example of how OPH is integrating QI processes and tools into how we work. So in 2025, the infectious disease program leveraged temporary staffing resources to manage the predictable summer surge in infectious disease cases. After that summer period ended, what we did is we analyzed operational performance measures to understand how those temporary staffing resources impacted the program's ability to maintain service standards. So a couple of examples of those performance measures included looking at case volume, case initiation time, case follow-up time, and the average number of cases managed by PHN. And we looked at data in 2025 and compared it to 6 years of historical data. And what we learned is that, yes, those temporary staffing resources were sufficient to maintain our service standards. And that was despite the higher case volume that was observed in 2025 compared to previous years. And by having that intentional performance measure and looking at the data, what the team was able to do was bring forward an evidence-informed recommendation for staffing needs preparing for 2026 to ensure that they were appropriately resourced to meet their service standards. And so that's just one example of how OPH has integrated QI practices into planning exercises that are already occurring. And I'll wrap up just by saying that even when capacity is stretched, I hope that you take away that QI readiness can still grow when we have the systems in place to enable it. We have clear priorities, and we also embed improvement into our everyday practice rather than see it as extra work that we have to add on. And I encourage everyone to think within your own organizations, what opportunities are there that you could be leveraging, or even look at work that's already underway and maybe looking at it through that QI lens to see how you can start building the conditions for QI or advance the conditions for QI within your own organizations. And with that, I'll say thank you and pass it over to Rob Hale.
Hello, everyone. Today, I'll be walking you through how we use program planning to drive both population health outcomes and organizational change. At its core, this presentation is about building a foundation that helps us plan intentionally, measure consistently, and improve continuously. I'll share how our planning process works, how we measure progress, and how those insights translate into better programs and services for our community. Next slide. So why do we plan? First, planning helps ensure we're aligned with the Ontario Public Health Standards, grounding our work in the requirements and best practices set provincially. It also ensures our programs respond to local needs. Each community is unique, and our planning process ensures our services reflect that reality. Planning also helps us understand what our objectives are, not only what we want to achieve, but the work, resources, and collaborations needed to get us there. And lastly, planning allows us to track how much progress we're making over time. Without measurement, it's difficult to know whether our actions are actually creating the change that we intend. Next slide. Our planning process runs from May to December, which gives teams time to reflect and plan ahead. The work itself isn't intensive across this whole period. This timeline simply accommodates the workflow, approvals, and budget planning processes that sit around actual planning work. We use a program planning tool to develop and monitor our plans, provides us with a consistent, structured way to document objectives, interventions, and indicators, among other things. Every team develops either program plans or administrative plans. Program plans focus on population health objectives, while administrative plans focus on organizational objectives. A key shift in our approach is that we start with objectives. That means asking, what outcomes do we intend to achieve, and what work will get us there? Within each plan, teams identify the activities or interventions that will lead to change, and select indicators to measure whether progress is happening. This helps us move from a task-based mindset, I do this because it's assigned, to an outcome mindset, I do this to create impact. Next slide. Our plan leads report quarterly on 3 key types of indicators: outputs, which track what we delivered; quality indicators, which track how well we delivered our activities; and short-term outcomes, which track whether we're seeing any early signs of change. Program plans also identify medium and long-term outcomes, but these aren't currently monitored on an ongoing basis. All of these indicators feed into our progress dashboard, which allow users to filter by year, division, and team. Strategic priority indicators roll up into the priorities dashboard, which allow users to filter by year and area of focus. We measure our strategic priorities in the same structured way as our program plans, because our strategic plan was built using those same principles. Together, these dashboards give us a comprehensive picture of how we're doing across all levels of our organization. Next slide. In terms of impact, teams use their indicators to assess program effectiveness. This means understanding what's working and what may need to be adapted, scaled, or discontinued. Additionally, each cycle of planning produces learnings that feed improvements to both the process and the tool. Our goal is incremental improvement every year, building a stronger foundation that helps us better achieve our objectives and deliver meaningful impact to the communities we serve. To show how our foundation is translating into measurable progress, here are a couple of quick examples from our recent work. Data quality in our program planning tool increased by 15% from 25 to 26, showing clear improvement in data completeness and strengthening the reliability of the information we use to monitor progress. And in 2025, we met or exceeded nearly 70% of our plan indicators, demonstrating that our planning approach is leading to meaningful results and helping identify where targeted programming or QI can maybe close gaps. And lastly, our approach also streamlines external reporting, with many annual service plan elements pre-populated through our planning work, reducing effort and improving consistency. And with that, I'll pass it over to Nastasia McNair, who will explore how CQI, planning and performance measurement work together to strengthen outcomes across their organization.
Thank you very much, Rob. As Rob said, I'm Nastasia, and I'm here to talk to you today about how we can enhance our outcomes and improve our work through quality improvement, planning, and performance measurement all together. And I will share that part of my work is also working with a team internally, so I work closely with our quality and monitoring specialist, as well as some of our foundational standards specialists who support the accountability work. Next slide, please. So starting off, taking a look at continuous quality improvement at Public Health Sudbury and districts, we really see this as a way of working. We try and embed quality improvement into what we do on a day-to-day basis and really try and move away from the thought that quality improvement needs to be conducted by experts. It's built into how we plan, how we use evidence, and how we deliver our programs and services. Our focus is really on making improvements and trying to make them part of our normal day-to-day. We try and look at what we can improve, who we're improving it for, how we can use the evidence to help guide our decision-making, and how we can simplify processes so we ensure that effort adds value. The culture of improvement is also supported with structures and governance. We have an internal continuous quality improvement committee, for example. We also support quality improvement through internal processes like program planning, as well as accountability monitoring. Improvements are happening at multiple levels across the agency, small tweaks at a team, for example, all the way to systems changes and agency improvements. Next slide, please. One example of a system and agency-wide improvement is our program planning process and some system improvements that have taken part as part of this evolution. And Rob just shared about his program planning tool. We actually learned from Southwest and from Rob when establishing this process. So this is a process that underwent CQI within our agency. We previously had really long Word documents where we were completing our program plans so we could pull information to work towards our annual service plan. We recognized that we needed a more streamlined approach, something that could support monitoring, measurement, integrating opportunities where we could actually have this done systematically. So we moved towards an online program planning tool to replace those Word-based plans. We know that planning is the first step in quality improvement, so we really wanted to consider and encourage quality improvement from the start. So this led us to include specific prompts in our online program planning tool. So we now have some standardized fields where we can include prompts for objectives, indicators, and quality improvement and evaluation plans. Also, this is our first season, so we're in the process of setting up data dashboards and reporting functionality. So like Rob, we can measure year over year and hopefully see progress. An evaluation of this tool and some ongoing committee work is also underway and planned as part of the next steps in this process through the agency. Next slide, please. One of the indicators or accountability measures that we are looking at including in our agency's planning dashboard is related to our accountability monitoring plan. Our agency accountability monitoring plan reports on our organizational requirements, our foundational and program requirements, and our strategic plan priorities. As part of this reporting process, we really looked at how we could show the strategic plan in action. And this is where we came up with some strategic priority performance measures. So they relate to each of our strategic priorities, and they showcase how we are making progress on our strategic plan. This is something that we can now include in our program plans and we'll hopefully build a dashboard so we can measure year-over-year progress. These accountability and strategic priority performance measures double as feedback mechanisms, so we can really learn and make informed decisions and improvements in our work. They are also linked to our quality improvement efforts, and I will go to the next slide. One of the strategic priority performance measures is our quality maturity assessment survey. So we heard about this from Dr. Pilato at the beginning of the presentation. And we as an agency have been using the quality maturity assessment survey as one of our strategic priority performance measures to help ensure our culture of continuous quality improvement across the agency. So we established this priority performance measure back in 2024, where we completed the survey as a baseline measurement. And we have since run it again and are hoping to run it year to year. The survey is an assessment and a diagnostic tool to help us understand how we experience continuous quality improvement across the organization. In 2024, we obtained an emerging score. We conducted a detailed analysis, which led to a work plan with activities that really tried to help build the culture of CQI across the organization, with some activities like training and capacity building. In 2025, in fall of 2025, I should say, we ran the survey again, and we've actually made progress to the progressing stage. So we've moved from level 2 to level 3 across the quality maturity stages. And this time we are going to be using those results to really help guide prioritization. We've done a detailed analysis, question by question, pillar by pillar, to really look at where we can focus our efforts to inform next steps in our internal quality improvement plan. Next slide, please. So with that, I think it's really important to see that planning, performance measurement, accountability, and quality all work together to contribute to improved outcomes and help us achieve our goals. Planning, performance, and CQI are interconnected. Planning helps set direction, measurement helps support learning, and continuous quality improvement helps drive our adaptation. Together, this supports our better decision-making, stronger accountability, and ultimately better outcomes for our communities. Thank you, and I will turn it back to Dr. Lamptey.
Thank you all for your insights. So clearly there's great interest in this conversation. There's lots of questions and answers in the question and answer box, and we'll do our best to answer as many as we can, either by typing a response or answering it live. But let's shift gears and open the floor for our dynamic exchange as people continue to provide their questions in the Q&A pod at the bottom. So Dr. Pilato, I'm going to start with you. How can public health units use the quality improvement maturity survey results and their individual health unit responses to inform local planning?
Yeah, for sure. I really think since the scores show there's low scores in that capacity and competency related to systematic improvement methods, staff training and QI methodologies, and awareness. This really means that public health units really can look to focus on like improving QI skills, training, and infrastructure to support sustained quality improvement, and really using these 2025 survey results as sort of benchmark so that you can identify the areas of opportunities in your own public health units where you want to focus your QI efforts to do the improvement work across your units.
Thank you. That sounds like a very practical way to apply the results to practice. And you mentioned the notion of benchmarks and opportunities that provides. And so I'm going to ask Nastasia, as you described your quality implementation journey, and with Dr. Pilato's notion of opportunities and benchmarks, can you tell us what do you think would be helpful at the local level for Public Health Ontario to provide as we support your quality improvement journey?
Yes, thank you. So as I shared, we've been using the survey to help implement our quality improvement plans locally. So the survey itself is something that would be incredibly helpful. So the more encouragement that we could do across all public health units, I think would be really great. It will allow for more comparison, a little bit more of benchmarking data. I also think that the results from the survey help us inform how we want to tackle our next steps and where we maybe need to focus our efforts internally. So, for example, we saw that we maybe want to continue to increase our capacity and competency. So, we will participate or offer more training sessions, maybe do some targeted training with different individuals who are on our CQI committee, for example. So, I think there's lots of opportunity to leverage the tool provincially and use it as a benchmark, and then internally to really help streamline and focus your efforts in your internal planning process.
Fantastic. Let's keep the enthusiasm rolling. So, Rob, there's a lot of interest in the quality improvement tool that you mentioned. So we'll have you give a shout out to that tool. But can you tell us a little bit more about how you're identifying quality improvement opportunities in your local public health unit?
Sure. So at the agency level, we've identified QI as a strategic priority. So that's certainly something that we're going to be working towards these next few years. And then at the program plan level, we're currently having staff select quality indicators in each of their plans. There's still some work to do to complete the activities to get to some of those quality targets, but that's something that we see materializing over these next few years as QI is kind of been highlighted as a strategic priority.
Fantastic. And just to close, could you give a few examples of what some of those QI indicators are that you've used in your quality improvement plans?
Yeah, so some of them revolve around like timeliness, accuracy, client satisfaction, and wait times.
Fantastic, very concrete. So Jessica, I'm going to ask you, part of Public Health Ontario's quality improvement journey is not just the survey, but as Nastasia mentioned, spreading awareness of the survey and different methods and approaches. Can you tell us about how you're incorporating quality improvement education in your local unit?
Certainly, thanks for the question. So recently at Ottawa Public Health, we launched a quality evaluation and planning community of practice. And what's a little bit different is that it's predominantly virtually based, so based on Teams, and it allows folks from across the organization. We have representation from all of our different service areas to engage in quality improvement, evaluation, and planning as well. And leveraging Teams allows us to take those opportunities really to just have quick little learning bites together or connect with others in the organization around quality improvement and seek support. And then also recently, Ottawa Public Health hosted Public Health Ontario to deliver the QI workshop with the ideas training. And we were able to use the folks that are on our community of practice, knowing that they already have an interest in quality improvement and interest to build their skills. So we were able to use them and they attended that workshop. So that's just one example of sort of on the regular, how we are building capacity, but also through more formal opportunities as well.
Fantastic. I see that there's a lot of questions. Some are really interested in how people are applying this locally. So one of the questions that I think is relevant to that is, how do we incorporate impacts into our strategic priorities and not just quantitative measures? Any thoughts about that, describing our work, not just quantitatively, but in terms of true impact?
I could maybe speak to that, Dr. Lamptey. So at Ottawa Public Health, we have our quantitative measures for our strategic plan, but we also have several qualitative measures as well. And what that does is it supports the teams that are doing this work to take a little bit more of a storytelling approach to articulate what are they accomplishing in terms of our strategic priorities to move us forward. Also, what are the challenges in doing that work as well? And we report twice a year to our Board of Health, and internally we look at it quarterly as a way to understand what impact are we having. And then, of course, in the context of a strategic plan, recognizing that true impact takes time. So sometimes impact and successes even just comes in those small incremental steps, not necessarily the achievement of our overarching goals. So recognizing what small successes and impact look like as well.
Fantastic. I'd also like to mention that we're joined by Marnie McKinnon, who is the Director of Quality Improvement here at Public Health Ontario. And since she's joined us, I'm very delighted to see that there's this question from participants about how quality improvement dimensions might fit or align with the updated core competencies for public health. And I think this is a very timely question. It's one we're actively exploring at Public Health Ontario. Marnie, is there anything you'd like to comment on with that question?
Sure. So good morning, and it's nice to see names and faces. So I do think that there is a direct alignment. So if you actually look inside the methods and tools section of the competency, the first one is using quality improvement to improve the service delivery across health units. So we do see a direct alignment. And as we said, we're going to be following up with them to explore, how do we work together and promote a shared vision, definition, etc. I would encourage people to really look at the definition and the aims that are put out there, and really wanting to share with everybody. They're not PHO per se, like we didn't sit and invent these. They're actually adaptations. So the definition is actually taken from Health Quality Ontario. And we've adapted it to really be for public health. So it talks about clients versus patients, teams versus providers, population health versus patient health and patient safety. And the dimensions, I think, are really important. And a number of speakers have touched on them today. So it's not just about how do you increase service level or efficiency, but it is how do you improve the client experience? How do you think about team well-being? And when you can do many or all of those in your quality improvement work, the richness, and I would say, as many of you have heard me at the sessions, the joy that can come from that when we are really improving things for both our clients and our staff. And that is what I think the power of QI can be for all of us. So it is thinking multidimensional. It's not just about more services faster. It really needs to be grounded in all of those dimensions. And I think that's both the opportunity and the challenge for us going forward. So thank you.
So I thank you, Marnie. I think we have probably time for one more question before we end this session. And there's continued great interest in terms of questions, which we'll do our best to incorporate into future discussions and outreach to local health units. And one of them is, how do we include frontline staff as well as members of the Board of Health to have interest, participation in quality improvement? And I'll ask that to anyone who has some concrete stories to tell about that.
I can start, and feel free to add any other panel members. So I think it's really important to think about this from the get-go. So as you're doing your planning and looking at any quality improvement process, it's important to think about why you're trying to affect change, but also who needs to be involved in that change, and then really trying to involve those participants from the beginning. So as an agency with our strategy, we have our internal continuous quality improvement committee, and we have representatives from many teams and many divisions across the organization to try and include them and bring different perspectives to the table. And then as it relates to a specific project, we will ensure that team members who are involved in that work are involved early on. With respect to the board, we share back our results. So with the accountability components, our continuous quality improvement and maturity survey, we have shared those results with our board, and we have an accountability monitoring working group of our board. So we do have a regular connection there as well. So really trying to keep informed and involve early on, I would say, are really important steps.
Fantastic. So I'm sorry to say that we've come to the end of this panel discussion. I'd like to thank our speakers for sharing their valuable perspectives and expertise. Your contributions have certainly deepened our understanding of how quality improvement is advancing across Ontario's public health system. Before we continue to the next session, please take a 15-minute break. You may join our next session on emergency preparedness by using the fourth link that was provided to you in your welcome email. Thank you all.